my monthly webinar. This is Dr. Valerie Frazer, board certified in vision therapy, and I'm going to be talking today about vision problems and dyslexia. So a little bit about me. I am the sole optometrist and owner of New Horizons Vision Therapy Center, specialized in vision therapy, vision development, and am a fellow of the College of Optometrists in Vision Development. Today we're going to talk a little bit about dyslexia, or what can look like dyslexia, but really be a vision problem. So first it's important to discuss what I mean by dyslexia. So for our purposes right now, I'm going to just say dyslexia is generally considered, when a child is performing well below the child's age level in reading. So typically, we're talking about kids that may be more than a year behind, probably even 2 years behind in reading. So, but what we're going to talk about today is some things often associated with dyslexia that really aren't dyslexia. So let's talk about those, some of the things that you might talk about or see in the literature or websites that are geared towards dyslexia that may not actually be dyslexia. So words moving around the page, inability to keep place on the page, words or backgrounds appear to be colored, distorted looking print, and prefers, large print or comics. Oftentimes dyslexia, making the print a little bit larger will make them easier for them. And then a lot of lay people think that dyslexia is about reversing B's and D's, and that's one aspect of dyslexia, but that's also not exactly what dyslexia really is. So first we're going to talk about these symptoms and why these things that I've listed here aren't necessarily what we should be considering dyslexia. And there's a lot of controversy about what dyslexia is and isn't, and even how to treat reading problems. A lot of schools have gone away from even using the term dyslexia. So partly I think because there is a lot of confusion around the term. And not all dyslexics look alike either. So, but today what we're going to talk about a little bit more is how a vision problem can sometimes look like dyslexia. And to do that, we're going to first talk about what good vision is. We're going to talk about poor visual skills and how they interfere with reading. And we're going to talk about how improving your visual skills can help poor readers. So first thing I want to talk about is what is good vision. So a lot of times people think that good vision is 20/20 vision. So we're going to talk about what that really means, why that may not mean that the vision is good, quote unquote, and we're going to talk about some other visual skills that are needed for reading that aren't often tested. So first let's talk about what 20/20 vision means. So you might have seen this chart before. Sometimes they're hanging around the doctor's office. You cover one eye, you read down as far as you can. So the red line here at the bottom is that's 20/20 vision. And what that means is that if you had 20/40 vision and you stand 20 feet away, you would be able to see that size of letter. You go down the chart, the number on the bottom gets smaller, so this would be like 2015. You go up the chart, so the very top is like usually 2200, sometimes 2400. So the bottom number really has to do with the size of the letter. The first or first number, first 20, has to do with how far away you are. So, it's mostly a distance test. Now, we know that most learning occurs, closer than far away. So a lot of learning occurs right there, within an arm's length for certain. So that makes this test, it doesn't always test everything. So I'm going to kind of do a little demonstration here. And I want you to read this on your screen. And as you're doing it, you can do what the words tell you to do. But you're going to pay attention to what's happening with your eyes. So I'll give you a minute to do that. So some of you might still be reading, but for time's sake, we're going to keep going there. So one thing I hope you notice that as you're reading, your eyes are first and foremost moving. So that's usually what most people notice right away, is that their eyes aren't staying still. They're making a lot of eye movements. And that's really important. The other thing is that hopefully, before you even started decoding those words and figuring out what they are, hopefully they were clear and hopefully they were single. So many of the patients that I see, those three things, clear single vision with accurate eye movements, are not there. And that's what's causing trouble with reading. So what might that look like? Well, we're going to talk a little bit today about the visual skills required for learning. So there's motor skills that I just talked about. We're going to go a little bit more in depth, the teaming, focusing, and tracking of the eyes. And then there's also visual perceptual skills. So that's more like the output. If motor is the input, how we get the information in, perceptual skills are the output, or what we do with that information. Vision is about deriving meaning from what we see. So we're going to talk about a few visual perceptual skills as well that can interfere with reading. So let's start with eye teaming skills. So I said, the words have to be clear and single. So this is an example of what it can look like when the words are not clear and single, when they're a little double. So you can still kind of make out what the words are, but it's really confusing and it's going to be really taxing. Now, a lot of times kids don't exactly see this, but they might see the words moving around a little bit. Remember, that was on the little symptom checklist that some websites give for what may be dyslexia. So eye teaming problems can make your vision look like this. So what do we mean by eye teaming? So eye teaming, you have two eyes. Each eye has a picture, and those two pictures have to overlap. And the only way for them to overlap is if your eyes are pointing in the same place at the same time and coordinating well together. So eye teaming is about using both eyes together. Now, some people have an eye turn that's way far out, way far out. You can see the eye turn. And in that case, then those pictures are going to be farther apart. And actually, it might even be a little bit less confusing, unless, of course, you switch which eye you're looking with. So if it's their eye, one eye turns out all the time, they're probably going to have less difficulty than if it switches. So sometimes the right eye's looking, and sometimes the left eye's looking, and then sometimes the right eye's looking, and sometimes the left eye's looking. Most of the eye teaming problems I see, and I certainly see the eye turns as well, but are smaller things. You can't cosmetically see them because it's a small difficulty with coordinating the eyes that can cause blurry and double vision. Sometimes they converge their eyes too much. So convergence is that movement your eyes make when you look up close. They turn towards each other. Sometimes they don't converge enough, and sometimes they converge too much, and that can make things more difficult. In fact, those are often interfere with reading more than someone who has one eye that turns out all the time. So let's go on to watching a little video, an example of what this might look like in testing. So this young boy here, this is trying to track and follow that little ball there. If you notice, he has a lot of trouble, especially when he goes right in that area where the two eyes especially have to coordinate together right by the nose. In fact, he looks away sometimes. It's a little fatiguing for him. So now we're going to look at a different skill. So now the eye behind that, it's called an occluder, that frosted lens, can't really see the ball. So he's really only using one eye to track and follow there. And what you're about to see is that things get a little difficult. And he's having some trouble, I would say, focusing on that ball, right? It's not easy. Very fatiguing. So one of the things that we see with eye teaming problems is that the patient gets really tired when they do near work. They fatigue quicker than they should. Now, some kids will buckle through it, and they'll get headaches and they'll get eye strain, but they'll buckle through. Other kids will just learn an avoidance pattern. So you might see more behavioral problems. They might lose attention when they read because they don't want to work that hard, and I don't blame them. So the other thing that can cause similar symptoms are focusing skills issues. So what do I mean by that? Well, there's a lens in the eye behind the iris, which is the colored part of your eye. There's a lens, and that lens is controlled by these muscles here. It's called the ciliary body. And when those muscles move, they move the lens. So when they relax, it helps you see things far away, okay? Relax the muscle, see clearly far away. When they work or do a little work, then you have to, that muscle has to work, and then that moves the lens so that you can see clearly up close. So focusing skills are all about being able to switch focus quickly from near to far and far to near, but also about being able to sustain focus or clarity for a long period of time. So if these muscles get tired here, and it's a lot of work to use to move that lens, then what you can get is you can get blurry vision. Or again, if it feels like work, some kids are just going to avoid and not want to do it. The smaller the print, the more work the focusing system has to do to get it clear. Same thing with eye teaming. The smaller the print, the more it has to do. So that's one area that can also cause, like I said, headaches, eye strain, or more often than not, lack of attention. Sometimes kids can start out doing well for a few lines, and then they start to fatigue, and their fluency goes way down because they're having to work each time they move their eyes to refocus and get the images together again. So when you start having to work at things that should be an easy and automatic process, you're going to slow things up for remembering what you read, remembering what the words are supposed to be. Maybe even they look a little distorted, so they don't look like the same word that you think they should look like. So it can get confusing. Sometimes the letters run together. So it can be, like I said, confusing. And I've talked with adults diagnosed with this dyslexia, in quotes, who say the words move, around the page, and that makes it hard for me to read. Well, words shouldn't be moving around the page, and I'll tell you why that's not, again, a vision problem and not dyslexia. So focusing skills, very important. The other thing focusing skills are important for is switching focus from near to far. So you got the whiteboard or the smartboard, and then copying information from one place to another, from the desk. It used to be chalkboard to desk, back and forth again. One thing is important to note about this is that if you are over the age of 40, you might have started to notice that this focusing problem, you're starting to have focusing problems up close, right? A lot of people go to bifocals when they're older. So that's a little bit different problem. So there, the lens itself starts to get hardened and harder to move. So focusing problems that are related to age, people usually tend to move the material farther away. Focusing problems in kids, they actually tend to get closer, and a lot of times you'll see them turn their head and use one eye. Again, that has to do with the relationship between the eye teaming system and the focusing system. Sometimes it's easier for them to focus with one eye than try to focus and coordinate both eyes together. So kids that get close to the page really pay attention to that. So next, we're going to talk about tracking. So I'm going to show you another video of a little kiddo who's doing some eye tracking. And so what you'll notice is that he's looking at that ball. I went a little fast, but he was using his head a lot, I would say. Here I told him not to use his head. Okay, so if you notice, then when he wasn't using his head to look, he was a lot less accurate, right? Okay, so now I have two balls. One is, it might be a little hard to see there. One's gold, one's silver. And I'm asking him to look between the two. So I'll say gold, silver, gold, silver, gold, silver. All right. So again, a lot of head movement. So there is a progression. This stuff is not, we're not born with 100% accurate eye movements. There's a developmental progression that goes on. So while we have the convergence system or that eye teaming system and focusing system usually are fully developed around 6 months of age, we'll say. Eye movements take a little bit longer. Accurate eye movements take a little longer. So we expect, though, by age 6 that they should be able to do that test right there with just a minimal head movement. Not a lot of head movement, just a little bit. And they should be able to do it fairly accurately. And by age 10, those should be easy and automatic. Maybe they can even answer some questions while they do all that. What happens when they're having difficulty in not making accurate eye movements? Well, what do you think is going to happen? So when they move their eyes from one place to another, if they're not accurate, they're going to lose their place a lot, right? So they're going to have to reread for information, or they're going to have to find their place again. And they're going to make all these extra little eye movements that are not helping them with the fluency or the comprehension. The other thing that can happen is that with eye tracking things, since it develops so much later, if the eye focusing and the eye teaming aren't working well, then most kids will have trouble with also eye tracking, especially if it was something that never developed. Now, if it had developed and something kind of messed it up a little bit, that may not be the case. But generally speaking, most patients I see have trouble in all three areas because of the developmental sequence that they go through. Here's another example of how print can look distorted when you have these type of visual motor skill issues. So things can look like they're running together, like down here, blurred vision, distorted, wavy print. Things that come in and out of focus are often an issue. So that's how we can have trouble with what I call the input, or the actual visual skills that have to do with the motor coordination, how that can affect reading. So now I'm going to talk a little bit about vision perception. And vision perception is really about deriving meaning from what we see. And so that's where the output comes through. So those of you that have seen this before will know right away what it is. But if you've never seen this picture before, then you might not really know what you're looking at. Looks like a bunch of ink maybe splattered across the page, right? But if I show you this, you might recognize right away, since we're in the dairy state, what it is. So it's a cow, right? So here's the ears on one side, the ear on the other side, the eyes, here's the nose. Now that you see it as a cow, if you look back to the picture without the outline, you can't not see it as a cow, right? It automatically, that's what your brain sees, because it now has derived meaning from what was just a bunch of dots or splatters of ink on a page. So that's what I mean when I say, vision is about deriving meaning from what we see. And once you see it, it sticks, right? So let's talk about some other things that can affect reading. So one of the common things I see, especially when the visual skills, motor skills are not in place, is that kids have trouble with what we call visual discrimination. So what is visual discrimination? It's being able to notice the details, right? So here we have a cow and a horse, right? But how do we know it's a cow and a horse? So if you look at it, there's a lot of similarities, right? They're both round. They're both large animals. They both have 4 legs. They have similar noses, but yet we see the differences of how the aspect of what a cow looks like and what a horse looks like. But if you have trouble noticing the details of things or noticing the differences between these two large animals might look the same. I don't want to get completely into this, but I think sometimes there's kids who have language issues and difficulty with language sometimes have an underlying visual issue as well. But that's for another day. So visual discrimination is also important for things like recognizing differences in words. So you have bad versus bed. They look the same, very similar. They have a similar shape, right? But they're a little different. One has an A and one has an E. Tired and tried. Same letters, slightly different order. So those type of visual discrimination things are important to learn in order to be good at reading. If you don't notice a lot of visual details, you're going to have a more difficult time with reading. The other important visual perceptual skill that we see is visualization skills. So visualization is being able to make pictures in your head. So getting a visual picture in your head is really important for things like visual memory. And so that's the ability to recall those pictures. So you have global visual memory, which is like the big picture, and sequential memory, which is like remembering what order things come in. Both are important, especially sequential memory is really important for things like spelling, right? To remembering the order of the letters that come. Now, if you have a mental picture of the word in your head, it's much easier to spell than it is than not having a mental picture in your head. So visualization skills are hugely important. Interestingly enough, the reading and writing go through different areas of the brain. So reading is much more of a recall, right? You recognize the word, whereas writing there's an output involved. So you have to actually know or have a visual picture of that word to spell it correctly often. Oh, so and then I wanted to talk about this book here. So if you want to work on visualization activities with kids, this book is a great book. I usually say it's for kids maybe who are anywhere from 5 to 8 or 9. Well, definitely 8, probably, maybe even up to 10. It's called See It, Say It, Do It, and it's by Dr. Lynn Hellerstein, who's a colleague of mine. And it has great activities for learning visualization skills, whether it be for sports or for schoolwork, reading, and writing. So that's a great resource that you can, for activities that you can work on at home that develop visualization skills. Thirdly, what I wanted to talk about for visual perceptual skills in reading are the concepts of directionality. So we don't think about directionality as being a visual skill, but it really is. So when we think about what letter reversals, which way the letters go, it's only in language that directionality really becomes an issue, or unless, I guess, you're reading a map or trying to get somewhere. Because objects, this is a wrench, and this is a wrench, right? They're both wrenches. We learn object permanence. We know that these two are the same thing, even though it's turned a different way. However, this is different, right? This is an E, and this is, I guess, maybe a 3. So in linguistic symbols, it's really important that we maintain that left to right and know which direction and have a concept of direction for that. So a lot of times in vision therapy, when we see kids with letter reversals especially beyond the age of 8, but really those concepts start to solidify around age 5. That's why you usually see a sharp drop between 5 and 8. As they start to really get the concept of directionality, you'll see a reduction of the letter reversals in their writing. So, but B's and D's, they look the same, just depends on what side the circle and this line are on, right? So a lot of things we work on in therapy relate back to directionality, concepts of right and left, and sometimes even up and down to solidify those concepts. And there's a progression that we learn. So we learn it on ourselves first, and then we learn it on others, and then we learn it on objects. And that's that final stage of understanding it out in space and on objects is where kids need to be in order to not reverse letters. Some kids just learn, just by the sight of it. But again, the directional concepts play a big role in it. So letter reversals are certainly, there's a lot of patients diagnosed dyslexic that do not have letter reversals. It's something that can happen with dyslexia, but that is not in and of itself dyslexia. So now we're going to talk about what I define as true dyslexia. So true dyslexia is really what we're talking about is a language problem. So it's more of an auditory processing problem rather than a vision problem. Everything I've talked up until now is more of a vision problem and not so much of a language problem. So true dyslexia, often we see some other things. So they might have trouble processing and understanding what they hear, some auditory processing issues. They might have trouble hearing differences between similar sounds. So th and s might sound similar to them. There might be difficulty with phonics, not understanding phonics. So kids that you put one flashcard up and they can sound out the word okay, that's usually not what I would consider a language problem, dyslexia problem, if they understand phonics. And then oftentimes you'll see other language delays like late talking, difficulty with rhyming. So they don't get the concept of rhyming is often more associated. It might be a little bit of language problem. So the thing is, though, oftentimes these kids have trouble with both. They have trouble, poor visual skills, in both the input and the output, the motor and the perceptual, and they have these language problems like dyslexia. So the question is, though, how are you going to get them to get further along in reading if you don't address these, right? If they can't sit down and do the work because their eyes don't have the visual stamina for it, they're not going to get as much out of any other type of reading intervention. So it's very important to screen out for these visual skills problems with testing. And it's really important to try to see a developmental optometrist like myself to screen those out, because many eye tests are just geared towards that 20/20, what you can see on the eye chart, and they're not looking at how the eyes are functioning in an ear. So what happens next? So how do you treat these visual skills problem? Well, that's what vision therapy is about. So here's an example of some pictures of some activities that we do in vision therapy. We do a lot with lenses that change how things look, get them to teach them how to coordinate their eyes together, focus their eyes, prisms that help with convergence and divergence. And then we also work with a lot of tracking activities and integrating the visual with other senses, whether it be gross motor, fine motor, and vision at the same time, vision and auditory at the same time, etc. Because we want that to become their natural way of seeing. I always use the analogy of like riding a bike. We want it to be just like they can get on that bike and they can ride and they can enjoy the scenery. They're not thinking about what their eyes are doing. And that's the level of response we have to get ultimately for them to do well in school and with reading. Vision therapy also, we start where they're at, and then it progressively gets harder and involves more multitasking. How successful is vision therapy? Well, the most common diagnosis we see is convergence insufficiency. So if we take that one, the National Institute of Health just did a study that showed that convergence insufficiency is treatable, and vision therapy is the best option for treating convergence insufficiency. So the success rate was 70 to 80%. I would say most programs is going to be closer to the 80%. The home program that they did with this particular study wasn't exactly what I usually do. It was good, but there's better ways to do things. In the CI study, from CI for convergence insufficiency, what they also found was that kids diagnosed with ADHD were 3 times more likely to have also convergence insufficiency, and that when you treated the convergence insufficiency, you saw a significant improvement in their academic behavior survey. So here's the questions on the academic behavior survey. So we've talked about some of these symptoms. How often does your child have difficulty completing assignments at school? How often does your child have difficulty completing homework? How often does your child avoid or say he does not want to do tasks that require reading or close work? How often does your child fail to give attention to details and make careless mistakes in schoolwork or homework? How often does your child appear inattentive or easily distracted during reading or close work? And how often do you worry about your child's school performance? So what we found is that treating the convergence and sufficiency significantly improves these academic behaviors. Other ways, so vision therapy, we've learned that's, addressing the problem of the visual skills. So what other things can you do to kind of help make things easier? So one thing I recommend is a slant board, and that's basically a little bit of a tilt, so usually about 20 degrees. So we don't typically, especially if we're holding the book, we don't hold it flat, right? We hold it at a little bit of an angle, and that's much easier on our eyes than having it flat on the desk. So you might think about either holding the book or providing, sometimes a binder can help just raise the top of the book a little bit. There's also slant boards that you can purchase that also raise and tilt the board a little bit as well. The material should be elbow to knuckle distance from the page. So you want them to be their elbow knuckle to distance, so they're going to be a little bit closer than an adult from the page. You also want to make sure that they're in a comfortable chair that allows their feet to touch the ground. Sometimes a physio ball, which is one of those large balls that you can kind of sit on, are good. But if they're too unstable, they're falling off it, obviously that's not going to work. But I do like the patient to feel like they're grounded. So if their feet are dangling in the air, it's actually going to be harder to quiet their body in order to focus their eyes. Experiment with print size. Usually increasing the print size or the spacing between lines is helpful. You might use a note card to block out information, or sometimes a window card, so kind of a cutout, especially when you get to chapter books when there's a lot of information on the page. That can be of difficulty. In fact, that's often a big red flag is kids that have trouble going from larger print to smaller print. They might use their finger to keep their place as a way to help them. I encourage kids to use it for as long as they need to, and when they don't need it anymore, their eyes will just take over. This is a math example, but you really want to try to avoid visual confusion. So by putting too much on the page, it can get really hard to isolate things. So you want to isolate problems in math, or like here's an example where I might use that note card to kind of block out and only use the ones that I had to look at. But decreasing the amount of visual information on the page is helpful. So I hope that you enjoyed this webinar. If you have any questions, feel free to contact us. We do regularly post on our Facebook page, so you can look us up at New Horizons Vision Therapy. Often post a lot of good tips about vision-related news as well. You can check out our website for more information, and you can certainly feel free to email us. Our email address is info@newhorizonsvisiontherapy.com, or call us for an evaluation, 608-849-4040. Thank you.